today's webinar. We will talk about ensuring access to education during COVID-19. I would like to introduce myself. I am Valeria Bujan, clinical psychologist from Slovenia. Slovenia is a country where we did not have a big problem with coronavirus, and we have recently started to open schools slowly. Now we open first 3 classes, and then we will open the other one. Before we start, I would like to notify that the call is recorded and will be published. You are all muted due to the number of participants. You can use the Q&A box to ask questions addressed to participants. There is a real-time captioning, so you can activate subtitles. You can see in the middle bar, it's the right, there will be a button, closed caption. You just need to click and it show subtitles. That there is a language interpretation available in French. You should click on the button interpretation and the right of the middle bar. Then you will see French, also is there French flags, and you can click on it. All presentations used in the webinar will be shared with you. So when we talk about Corona, and when we close schools, we have to know that kids with disabilities are more weak than ever. In an effort to limit to spread the COVID-19, many governments have taken the step to close schools, forcing students to temporarily continue their education from home. To enable teachers to teach their students remotely, many schools and training really places have utilized the opportunities of online platform and digital learning tools. Homeschooling and the use of these online tools has brought new challenge to learners, families, with the needs of the additional support of parents. But we know parents may also have their own work obligations and access to the appropriate resources, including computers and the internet. For many learners with disabilities who do not always have access to the education and mainstream settings, the move to online learning brings with additional barriers as well as opportunities. When we talk about Corona, children will be followed with the changes in the happenings around the coronavirus. How to recognize your discomfort in meaningful equivalent? It's important that we don't deny the situation to children with the statement that nothing has happened. Our experience showed that we had to talk a lot with them and we have to explain them that because of the virus, we can hug, we can't work in a group, visit friends, grandparents, and so on. This webinar today will bring together support service providers, trainers, and teachers to present and discuss about few topics. How education support services can adapt to meet the needs of learners and their families while homeschooling. How support services can support learners and their families as schools begin to reopen. within the COVID-19 lockdown measures. The specific training needs the teachers to provide inclusive online schooling to learners with disabilities, and the key actions that must be taken to ensure that online learning platforms are fully inclusive in the future. This is for beginning. We have in EASPD office Timothy Gillian, and Timothy, I will give you a floor.
Thank you. Thank you to all the participants that joined us today and to the panelists. So we'll have a very interesting discussion when we look here at education and the importance it has in developing an inclusive community and putting the first steps in developing inclusive environment and mindsets for the children, their peers, the parents. We see still that with the COVID-19, the situation changes. It's crucial in this period to keep inclusion on track for this, for our children, for the children that matter. So we'll hear from three participants, from Elena, from Anemi, and from Miguel. We'll start from Elena, who's coming from the Agency for Social Development in Bulgaria, and who has is a specialist from social services, and who will tell us more about how situation is doing in Bulgaria. So Elena, you have 8 minutes. You can share your screen, and thank you very much.
Hello to everyone. My name is Elena, and I'm working in Agency for Social Development Vision. We are a social service provider for children and adults with disability in Bulgaria. Today, I'm here with you as a representative of National Alliance for Social Responsibility in Bulgaria and the first Bulgarian member of EASPD since 2010. For 20 years, we develop our services, and now we have 3 centers for social rehabilitation and integration for children and adults with disability. And we provide a unique service for Bulgaria with the help from our municipality in Varna, in our town. We support 120 children with disabilities. Our social assistant support children with educational needs in mainstream kindergarten and schools. The goals we follow with this service are inclusion and independence for those children. Normally, we support the children during school year and the school vacation too. They visit a different type of social services, and they need additional time for preparing themselves and to practice already learn. Almost every time at the beginning of the year, schools closing because of for 2 or 3 weeks. This year, it continues in a state of emergency because of COVID-19. All kindergarten and all schools closing, and education continue from home. Unfortunately, we are not familiar with online learning in Bulgaria. For a couple of days, all Bulgarian teachers had to adapt their lessons and way of teaching. Some of them, they don't have technical skills or necessary devices at home. We don't have digital manuals, and fortunately, some of publishers released for free their versions. the teacher choose independently the online platform, and it's a kind of mix now of everything, of Facebook, Google Classroom, Zoom, Teams, and etc. On the other hand, there are many students without internet connection, or very expensive internet connection for them, technical support, or even adults around them to help with learning. In the beginning of March, the measures were very strict, and our assistants were in paid leave for almost one month. During this time, we started to adapt our service and to establish new ways of work. We made research through all parents and assistants. We sorted the result and start to work in two directions: possible and not possible online work. There were many different cases. Parents or assistant without the possibility to work together, or a child with a disability that doesn't allow work from a distance. In some cases, it had to swap assistant of the children they work with. Our employees were faced in front of many challenges too: lack of technical skills and devices, poor internet connection. They couldn't work from a distance with children. For this reason, we start with training on different related subjects. We've made tests and discussion by phone with those who we met. We kept physical distance, and we took measures, of course. With those for those who couldn't work from a distance, we prepared guidelines, and we supported them daily if needed. The role of parents was crucial, because they had to give more from their time now, more efforts to work with their child, with their children, and to do their working task in the same time. We realize that a big part of parents doesn't have technical skills, and it was very really a challenge to support them and their children. At the end of April, a decision was made. The school year will end from distance, and the final exam are scheduled for the next school year. All social services are working online, and we are not allowed to work directly with our users. Kindergarten opened yesterday, and some of our students, our assistants, are working now, and in this moment. They had to declare their consent for work in this situation, and we provided them a helmet and gave them instruction for work, how to work. We try to figure out how to improve our service and to adapt them in better ways. Our Center for Social Rehabilitation and Integration, they work better and better from a distance. The courses continue successfully, and the users are grateful to be able to connect, to communicate with other people. Unfortunately, our service of social assistant for inclusion of children with disability should adapt now in this new situation for everyone. We have to transform our aims, our goals, even our way of work. We try to organize to go home, to go in the home of the children, and to assist parents and children in their daily task, and to help them, because parents have to start work now, and it's very difficult for them. Our assistant mainly assist children in social learning, and it's very difficult to do their job now from distance. Now they have the possibility to develop their skills and to find a new way to reach the children, but it's really very difficult for us, maybe for you too. We support them daily. If it's possible, we help them to improve their digital skills and technical ability.
Thank you. Please try to
Yeah.
Thank you very much for this presentation. And it's indeed interesting to see the challenges that all stakeholders are facing. Interesting to see the challenges that all stakeholders are facing in this crisis: the parents, the staff, the teachers, the children. For reminders for the participants, you can ask your question in the Q&A in the box in the middle, so don't hesitate to, if you want to interact with the speakers, to put your questions there. We'll cover the question after the 3 presentations. And don't forget, you also have access to interpretation and closed captioning in the options at the bottom of the screen. We will now go to Miguel Valles, that will bring us the perspective from Portugal, and how going online has brought opportunities, but also some difficulties. So Miguel, go ahead. You have 8 minutes. Thank you.
So good afternoon, everyone. I hope you can hear me. I'm Miguel. I'm from Portugal. We at CACD, we are a resource center for inclusion, and we, for 40 years, we were a special school, so that has reconverted their services to support mainstream schools. So my presentation is about inclusive education at home. So we call this inequality on steroids, because what we experienced in equality, we are getting away with it and getting further away from our state of play. So in Portugal, about 98% of all students with disabilities are in public mainstream schools. So this was a reconversion of special schools into resource centers to support inclusion, and we are now partners. We are external partners of schools, and by definition, every student with a disability is enrolled in a mainstream school. So in the local mainstream school, so we do not have this a school that gathers children with the same kind of disability. No, all students go to their local schools. So it is our job to support all the schools that exist in the community. So what we are facing is a school that is being closed since March the 16th, and how we continue to develop our services, how we continue to support schools in this process. So we have a special provision that is being made by schools. So schools have been closed, yes, but some exceptions were made for children where their parents are health workers, they work in emergency teams, and other priority personnel. So we still have some some schools that that support just a few students. The main concern was about meals to be provided for students with economic difficulties and students with severe disabilities. So the law in Portugal does not state that a child needs to be identified as having a disability to get extra support. It's just the process is much more automatic. So we call this additional support measures. So every child that has additional support measures, independently if he has a disability or not, can attend the school. And this was the beginning of the process. However, some students were placed in empty schools. So as you see, so few students were allowed to return to schools that many of them were just about 2 or 3 students in a school that used to have 500 children. So it is not a very good decision or a very good end up with this kind of awkward situation. And of course, most of them as they return to their homes, since also some limitations about transport were in place. And by returning to their homes, they were supposed to have a platform, or a platform has been created to serve all children in every schools, but not targeted for students with disabilities. So we are trying to work with schools to develop this more specific tools and more diverse and more attractive tools so that teachers can use them. So our support is not by providing support directly to the students, but to provide support to students and schools, and how can they develop their services to target students with disabilities. And of course, we end up with a no differentiation between students, as it was anticipated by their individual educational programs. So we are trying to fine-tune this relationship, since we are expecting the next year would resume in not in this kind of emergency situation, but half the time in schools, students in school, half the time students in the virtual classroom. So this will continue for September, and we are trying to support schools by designing this, fine-tuning these programs that can also involve students with disabilities. And we end up with a very, very awkward situation that we, since school and we as a service provider stopped having contact with some families that they cannot access this kind of technologies, they don't answer the phone. We are concerned because some of the situations we've seen as early school leaving. So as the child has left school or not, and schools cannot answer directly to this situation. So we are concerned about early school leaving for children with a disability, because they stopped attending schools. And if this happened in schools, in physical schools, they would be targeted, and there would be procedures to be taking into account. But since it's a virtual school, things are not taking the necessary measures to support and to provide service to these students. So as a resource center for inclusion, of course we had to make a lot of adaptations. In a way, we are an external partner from school, so we cannot, by definition, we cannot contact directly families. It must be in the educational program. Our support must be very clear. What is our objectives, and how can we support schools in this way? So immediately we started to ask for permission to contact families, and we immediately started to give this virtual support for families, of course, that has this kind of technologies. This motivated also, it was a nice outcome, the communication between schoolmates. So these students with disability are in mainstream classrooms. So this motivated some more connections that might have been not as easy in a physical way. And we started to develop, as Irina stated, some materials, some exercises or videos for families that would ask us to do this. So we didn't intend to overflow families with materials, with videos, with many exercises. Just depends on the family dynamic of this. So we have to at least try to maintain these daily routines that families and children were used to, accustomed to, and keep families informed about what is changing, what is the near future expectations, and what community resources they can reach in case of difficulties. Of course, in the other hand, we have families that have absolutely no support, no ways of contact. And for them, we created what was our main concern, a most easily, almost like a hotline, a phone line that is free for everyone, that can reach us, and they can talk to an expert person that can inform them about their rights, about the support that for children with a disability. And now, well, since we are an external school partner,
please try to wrap up.
Yes, it really gave us more contact with families. Some families started to be more present during our conversation, and the contact to professionals, therapists, psychologists, physiotherapists, and started families to realize some of the true capabilities and difficulties of their own child. So this promoted a much closer contact, and some parents felt more empowered to play, to follow a daily routine, and this interaction in a significant way with their child. Again, this only happens on the family that has access to a PC, internet, and of course it's able to use it. So at the end, what we end up with a bigger quality gap between schools. We have very good schools that has became greater. So we have good schools that are now excellent schools. They have the ability to diversify their content and motivate their children. However, on the other hand, we have not really great schools that even struggled in a present way, that have now became much worse. So the gap between schools is increasing, and indeed is our big concern for the next school year, that we are trying to support schools. So thank you very much. I think I got the time right.
Thank you very much, Miguel. For a reminder for participants, all the presentation will be made available after the webinar. So indeed, we see technology is wonderful when you have it, when you can use it. Miguel, if you could stop sharing your screen so that Annemie will be able. Now we'll go to Annemie Jennes from Catholic Onderwijs Vlaanderen. We'll talk about the situation in Flanders and ensuring the access to education even during time of crisis. Annemie, you have 8 minutes. Thank you.
Thank you. Hello, everybody. My name is Annemie. I'm from Flanders, Belgium. I'm a psychologist and a senior policy officer working in the unit of learners. First, just to situate Belgium, I'm talking about the blue part, the part in the north. But the situation of education in Flanders and the Walloon region is a little bit different. But all the measures that the government takes for the COVID-19, they are all the same for the whole of Belgium. But now I'm going to talk about the Flanders education part. So about my network organization, we are a service provider. Our name is Catholic Education in Flanders. We are one of the 3 educational networks in Flanders. We have about 65% of the market share. And we have more than 2,000 mainstream schools. We also have 15 support networks, and these are supporting the students and the pupils with special educational needs and their teachers in mainstream schools. We are moving towards more inclusive education, but we still have a lot of special schools, about 200. And in this presentation, I will focus on the students and the pupils with special educational needs and their teachers, mainly in the mainstream schools, and the work of the support networks. So what about Belgium? Yeah, we are struck about the COVID-19 virus. From the 16th of March, all the schools were not really closed, but all the classes were suspended. From the 18th of March, we have a lockdown in Belgium. So all the adults needed to work at home. And that was the start of the really challenging combination of working at home and having the children at home, because most of the children were not allowed to go to school. So all classes were suspended, but schools needed to stay open for 3 groups of healthy children. And the 3 groups are children of parents who work in a crucial sector. There was a list made by the government, and for instance, these were parents working in, of course, the health sector, food supply, distribution, and so on. A second group were children and youngsters in special education and their boarding schools. And a third group, children who might be in danger at home, for instance, where there is domestic violence. Until Easter holidays, schools were only allowed to organize distance learning of subjects that were already taught. So no new subjects, only pre-teaching. From that moment on, we created a special Corona website where we published all the actual guidelines for the schools and also a lot of materials for distance learning, like lessons, materials, movies, and so on, to share with all the schools so the teachers can use that. And also we deliver a lot of front office service to answer the many questions of schools. Our support networks, the support workers, they could only support children and teachers at distance. This means online via PC, but also via social media, because there are children They don't have a computer at home, but more of them, they do have a smartphone. So they explored new ways to get in touch with them, to keep in touch with them, like Facebook Messenger, but also TikTok. They were very creative about that. We also have examples of support workers who brought boxes to the homes of the children with material, and even teachers that cycled, went by bike and went to the homes to have a chat at the door outside, because they are not allowed to enter the homes. After the Easter holidays until the 18th of May, all the classes remained suspended, but the schools needed to stay open for these 3 groups of healthy children. Then it was allowed and also obliged, in fact, to organize distance learning of new subjects. So we updated our website with tips how to select new subjects for distance learning, but also we got a lot of questions about how to evaluate, and also we gave tips about that. And for the support networks, it remained the same. They could only support the children and the teachers at distance. From the 18th of May, the schools reopen in different phases and also for different groups. But first they have to make a risk analysis, and when this risk analysis has been proved by the government, then they can reopen. So they have to take into account social distances, hand washing the hands, and wearing a mouth mask, and so on. It is still distance learning for those who could not come to school or not allowed to come to school. So we have children that have to go to school, and we have children that are not allowed to go to school. And also the schools still need to organize care for the children of the 3 defined groups in these closed bubbles. Maybe a word about these closed bubbles. They have to remain in the same little group the whole time. They cannot mix these groups. The support workers, they got new possibilities. From that date on, they have 3 possibilities to support. First, they were allowed to go to the schools to support, but only after an approval of the risk analysis. They can only support in 1 school. Before COVID-19, they supported in many different schools, but now it is 1 support worker in 1 school. The second possibility is to stay and to give support at a distance. And also a new possibility is that they can go to the home of a child to support. But this, of course, under certain safety conditions. And from June, the schools can open for more children. The government still needs to make a decision about the exact date. But again, first they have to make a new risk analysis. And when it is proved, they can reopen for more children.
1 minute left.
Of course, we have some problems faced. We have some challenges for the futures. At the first, it's the same as Miguel from Portugal told us. We see a lot of differences between the schools, and even these differences become more visible. The second problem we have is the digital gap. Also, Elena and Miguel told about it. We have a lot of families who don't have a computer. There were free computers and free internet provided, but then we faced the problem that they didn't know how to use it. There is also, again, these differences between schools. They also have different policy making capacity, and this results in different guidelines for teachers and support workers. And also within a school, we face differences between teachers. Some of them give very interactive online lessons, some of them only a PowerPoint with a voiceover, online chats, also hard copies, tasks. Some of them give feedback, not so a lot of differences. I would like to say something about the social learning. A school is more than learn the subjects you have to learn. It's also play together, and this is what we miss. This is what the children miss in the schools. And for some of the children, it's also a positive effect, because yeah, like we see some children with autism who like it more at home than at school. And also the practical lessons and the work placements are a problem because we cannot organize them from a distance. Then I would like to mention the newspaper or the letter from Inclusion Europe about the lack of education of children we face with intellectual disabilities. We also recognize this in Flanders. It's a big challenge for this group of children. And also, we emphasize the right of reasonable accommodations. This right remains in full force also in Corona times. And also sometimes new reasonable accommodations are needed. And we have made a guideline with these basic principles for all the schools to let them know that they really have to apply the reasonable accommodations for the children. So it has to be custom-made, non-discrimination, consultation, also personal assistants, nurses and interpreters need to be allowed at school. There are some adaptations needed for computer, the daycare for children in a vulnerable home situation remains, the right to subscribe in a new school remains, and also, of course, the mond mask. And I have a very nice this I really want to share with you, because in Belgium we have this person. She is an education assistant in a school for the deaf in Brussels, and she designed this transparent mask, and it's really it's really a hit in Belgium, because it's not only good for deaf children but also for children who are afraid from the mouth mask, because if you use this with a transparent mouth mask, you can see the lips and you see a lot of more of the mimic of the face. So it's really nice. Just one more slide to end this presentation. What about our role as a service provider? It's our role to provide correct and good information. We created this Corona website with actual guidelines and a lot of material. Also about psychosocial well-being, because we face a lot of problems with children who are afraid and so on. For instance, also visualization of the safety measures with beta communication for autistic children. We put a lot of effort in our front office service to talk to the schools, answer questions. We have a role of advocacy to negotiate with the Minister of Education and the Committee of Virologists. And the new challenge is to prepare the new school year. So this was my presentation. Thank you very much.
Thank you very much, Annemie. Indeed, the challenges are not stopping right now, and it's just new opportunities to try to find solutions. While I have you on the line, we have a question already for Belgium. So if you look into the Q&A for participants, you can ask questions, and I can also see the questions. So the question is, I understand special education schools in Belgium have remained open. How did they adapt spaces and routines with students, especially those who might find it hard to understand the situation, keep distances, put on a mask, etc.?
First, I must say that not all the special schools remained open, but most of them did. And I talked about the risk analysis. There are some adaptations for the special schools. And yeah, it's not that easy. As one very big element is the bubble. I talked about the bubble, the fixed group. So you always have to put the same children together with one teacher. And of course, it's not possible to keep social distance with children who are very mentally disabled. That's the same for the toddlers and the kindergartens. So yeah, they stay open and they try to do the best they can. But the principle of the contact bubble and of course the mouth mask, all teachers need to wear a mouth mask, and these are the two, and of course washing the hands. These are the three main measures that they have to take into account. And it's a difficult story, and a lot of special schools had a very hard time, and they still have, but they try to stay open.
Thank you. We also have a question from the group for Elina. So Elina, a quick question. So where it was not possible to work online with the students, you talked about with the parents on the phone and gave guidelines, correct? Apart from the staff training of how to use online services, was there any training possible for the parents as well? So support for the parents, and how was it organized for Elina?
Unfortunately, we didn't have enough time to adapt our service and to support parents in this kind of challenges. It's our future goal, really, because now when the kindergarten are open, it's more. It's better for parents, and they're free for our lessons. And maybe the next month we will start online something like webinar, but for parents. Yeah.
Thank you. Indeed. So hearing the three panelists here, thank you to the three of you for your inputs. You all have come with the issue, the digital gap that for the parents, for the students, for the teachers. And here we see Elina saying that there's not enough time to train. So I will give you a very easy question to the three of you. Miguel, you mentioned that there's a widening gap. How to avoid this? We are now coming slowly back to school. We hopefully will start in September. What can we do to avoid this, to not let this widening gap increase, to bring the schools back together and to give the support they need to the children that are most vulnerable?
Well, for me, it's a very profound reflection that schools have to make. Schools cannot try to do exactly the same as they did where their schools were open. So it is not a direct link from, okay, as a teacher, I used to have this kind of classroom and the program, and now I will just do it in front of a camera. This is not enough. This does not involve everyone, and it is a wrong conception of my role as a teacher, as an educator. So I think a bigger reflection has to be done by this. That is why we see this gap. We see the schools that know exactly their role as an educator, as a teacher, yes, but focused on every skill of the child and really concerned about individual needs. And then schools that are here to deliver a program, deliver a content. So for me, our support to schools is to include other skills that surely schools can always focus. I'm talking about these soft skills, how to promote contact between classmates. As one good outcome of this was that new relationships were established by a virtual world. Students that really did not connect with each other in the same physical space, they really do in a virtual classroom. So as a teacher, I need to promote free contact between our students, and I think it's a way to see my role as an educator, and see how these tools that will be continued to use after, because we will see the next school year will start, yes, with hopefully schools will open schools, but not in a traditional way. I think we really it's a real a moment that we see after COVID and before COVID. You know, schools really need to change, because this has proven, as Anami said, this is the ideal world from some students. Children with autism love this kind of interaction. It's very safe for them. So how not to include now this tool when we will start the next school year? So we should include good things on both worlds, virtual and the physical world.
Thank you. And for Elina and Anami, as a bit of follow-up also, and in that changing, what is the role of service providers? How can service provider help?
What we can do, we can put the good practices on our website and try to share it with our pedagogical advisors that come in the schools. What I would like to add to the very interesting answer of Miguel is that the social aspect and the interaction is very important. If a teacher only gives a task online, and or only a PowerPoint with a voiceover, and when there is no interaction between the teachers and the students, then they fall off, then they are not connected. It's the same with the children, the connection between the children. If they can chat, if they can interact like we are interacting in this Zoom, then it's good, it has positive effects. But if that is not the case, then it becomes very hard. I would like to add some positive aspect from this the distance learning. It was in the news tomorrow that there is less bullying amongst children. And maybe that's also an effect of how a teacher interacts by the computer with all the students. It's also very important to mention the good things and the positive aspects. So our role is to share, to connect, to share the good practices and to connect the schools, and also with our pedagogical advisors who come to the schools, with our support workers who come to the schools, to share and to try to share the good practices. We can never oblige a school to do something in this or that way, but we can try to convince them by sharing the good practices.
Elina, some concluding words also?
Yes, we can give advice and guidelines to the parents, to the teachers, but we are independent. We are dependent from them, and it's really very difficult to work with our social assistants from distance, because we are dependent from the time and from the parent. If they don't want to work in this time, or they can't work, for us it's very difficult. And for this reason, we will start to prepare them and develop their digital skills for the future.
We have another question on the Q&A. Shouldn't we also make technological tools and platforms more accessible for children or people with cognitive difficulties? How can we do that? And also reinforce these skills in schools, including special schools. So, Elina, maybe you want to follow up on that, or if you have anything, otherwise, you're muted. You're muted, Melina.
Sorry, I'm not sure I understood the question.
Should more is how to reinforce the technical tools and platforms for children, persons with cognitive difficulties, and how to reinforce the skills, the technical skills in schools.
We are external provider in the schools and the kindergarten, and we can't implement anything there. We just can give advices to the teacher and to director. And if they will make some changes, some digital improvement, it depends on them. We can't make it.
Thank you. I don't know if Miguel and Amy want to come on that point.
Yeah, as we are also external provider, and of course it is not our. Yes, I understand, Elena. It is not our job to do what the school is meant to be. We are not here to substitute schools. However, we have to help them. I think we have beautiful tools. I think we have such a diversity of professionals working with us: speech therapists, occupational therapists, psychologists, social workers, psychomotricists. I think we have many tools to share and to help schools how to adapt some of the curriculum or some of the classroom that is being prepared. I think we are there not to substitute the teacher, but to help the teacher how to accommodate certain individual aspects of their child. I think we can do this, of course, if the teacher wants help. Yes, but I understand, Elena. Yeah.
Okay, thank you very much. Time is coming to a close, so I will have to start wrapping up. Again, thank you to Valeria Boujan for the introduction, to Elena, Anemi, and Miguel for the presentation, and thank you to all the participants for joining us. We have seen here that really English education is crucial to keep the children involved in society, to start social teaching, to start this interaction, to create this social inclusion. And schools that are doing good are doing better, which is great news. It is possible. This crisis doesn't mean we can't reach out to these children, but there are small crises happening all over Europe where those children are left behind. They drop off, they don't receive the support they need, and it can all be avoided if there's a common decision, if the schools take their part, if the parents receive the tools and the training. It's a lot. But here we have received some very interesting tooltips on what can be done. We have seen from Belgium, from Flanders, online support. There was a community tool and platform in Portugal. Bulgaria also has been training staff to support better children online. And this is what we have to do. We have to prepare now for whatever happens next. And even if we don't go back to anything as drastic as we have now, it is a new tool. It is something that we can use to support children better and to find new ways, and where schools also can find new ways to adapt, to have more flexible curricula, more flexible classroom, to open up new opportunities. And it's unavoidable that these technical skills will be needed by teachers, by staff, by children. So we need to start now developing these to avoid any digital gap that will come in the future. And as a bit of a segue, what is needed for that is, of course, funding. So I would invite you all to join us next week. There's the Commission organizing a very interesting webinar on the funding as response to the COVID. So the CRY and CRY Plus assistance on Wednesday the 3rd June. And it's really a help desk to answer your questions on how to use it, how if you can access the funds, how to access it. So I invite you all to join this webinar. It should be very interesting for all of us, organized by the Commission. The week after, so the 10th of June, we'll stay with the children and we'll go to early intervention services. where we look at the needed legal framework for early intervention to be able to provide the necessary financial response and guidelines for services to support young children this time with disabilities. Also, don't hesitate to join our Facebook group, Joining Forces, where we talk about the COVID situation and how to support each other. And you can contact the EASPD help desk if you are EASPD members. I really look forward to chatting with all of you again very soon. Don't hesitate to contact us. For reminder, all the presentations will be made available to all participants. I hope you enjoyed this session as much as I did. I invite you to join me in thanking again all the panelists and wishing you a very good afternoon. Thank you very much.
And in the end, I want to say, Timothy, thank you very much to be moderator, and it was very well. So bye-bye.
Thank you. Goodbye.
Thank
Ciao.
you.
Thank you. Bye-bye.